Hi, this is Mayor Jim Fiorentini. I'm going to take my mask off so you can hear me, but whenever you go out, I want you to leave your mask on. This is Mayor Jim Fiorentini with an update for the week ending April 24th, 2020. We now have 398 people in Haverhill who've been infected with the coronavirus. We had 20 more cases come in last night, all of which were people who had tested earlier, but they were reported late because of some errors in one of the state reporting labs. Many of the people reported last night were already recovered by the time they reported to us. Of the 398 total, tragically, 8 people have died. Now, I don't want you to think of them as a number. I want you to think of them as our family, our brothers, sisters, cousins, mothers, fathers, aunts, and uncles. 9 people with infected are hospitalized now. We are pleased that so many people in Haverhill who have been infected are recovering. We have 160 who are marked as recovered and released from isolation. We work every day to do things to keep you safe. Yesterday, the Board of Health in Haverhill met. They required all workers who work in food establishments, takeout places, restaurants, supermarkets, etc., to wear a mask all of the time. And we want you to wear a mask whenever you go to the supermarket. We also set in place some reasonable restrictions so that those nice celebratory birthday and graduation parades can resume. We want them to resume. One big problem here in Haverhill and all throughout the country is in nursing homes. Tragically, nursing homes in Haverhill don't have a pandemic plan that required critical personnel to live in the homes and never leave. And maybe they couldn't for obvious reasons. But what happens is one worker gets infected through no fault of their own, and that spreads all throughout the building. Here in Haverhill, we've had 60 patients who have been infected. We had 22 cases linked to the Wingate, that's both staff and residents, 28 cases at Pennacook Place, and 40 at Oxford Manor. Each of those places is working with the state and doing everything they can to protect their residents and their workers, and I want all of you to know that. And remember, those numbers are both staff and residents. One of the problems in nursing homes nationwide has been a nationwide shortage of critical equipment. I don't know how this ever happened, but it did. Nursing homes haven't been able to get sufficient masks and other equipment for their workers or their residents. Now, cities have no authority whatsoever over nursing homes. That authority belongs to the state. But we cannot sit back and allow our residents and our employees to get sick and die without doing everything we can to assist. We made a pledge a week or two ago that no one who works in Haverhill or who lives in a nursing home or works there will go without the critically needed equipment they need to protect themselves and to protect others. The city found someone to sell them to us. We went out and purchased 7,000 surgical masks like these, cloth masks, and I'm proud to report to you today that we've distributed over 5,000 of these masks to nursing homes, to healthcare providers, and to hospice nurses. We're very proud of our efforts, and I don't know of another city that's doing this. I hope you agree with me this is a good use of your tax dollars. The total cost was around $15,000, and hopefully we can get reimbursed from the federal government for this. We've also made a pledge that we won't allow any family in Haverhill to be hungry in this time of crisis. And I have some news to report to you on this also. Our school department has stepped up to the plate and delivered thousands of breakfasts and lunches to the children of our schools and their families. They're doing a great job, and I'm very proud of them. Every day they distribute 900 breakfasts and lunches to students and their families. We've distributed about 25,000 meals since this pandemic started here in Haverhill. Our Meals on Wheels program has again stepped up to the plate. That's not run by the city, but we work with them. And they now deliver about 300 meals to homebound disabled senior citizens. And the city set up a food delivery program to buy and deliver food to those senior citizens who cannot get to the market and shop. Right now, we're buying and delivering food to about 15 families who can't get to the market safely. Now, here's what I think is the best news, and that's what all of you have done. The food pantry at Sacred Hearts Church run by a great guy by the name of Bill LaPierre, sent out an appeal for help, spontaneously without anybody asking them to do it. People have been going into Market Basket and donating part or all of their stimulus checks to buy gift cards to buy food for the food pantry. Some businesses have stepped up to the plate to buy food to distribute to various charities throughout the city, and all together, without anybody even asking them, they've raised an incredible $14,000 for Market Basket gift cards. I'm going to ask you for help. We've worked with the United Way, with Representative Andy Vargas, with the Chamber of Commerce, and with several other groups and nonprofit groups to set up one way for people to donate. It's called the One Haverhill Fund. Go on to the United Way website, look for United Way of Massachusetts Bay and the Merrimack Valley, and you'll find it, and click on the One Haverhill Fund. If you're in a financial position to help, and I know that not all of you are, but if you are, please give whatever you can. Now, I wish that was all the news I had to report, and that I had some better news to report, that we're going to return to normal, that it's all over. Unfortunately, it isn't. The state reports they had 3,000 new cases reported yesterday and 178 new deaths yesterday and today. I continue to believe that we're still in the surge, but that we're over the peak and that we're going to come out of this okay. I talk to the hospitals around here all the time, and they all tell me that they can handle the surge. And Partners, Mass General says the same thing. They can handle this. We're going to get through this without our medical facilities being overwhelmed. But all of that only happens if we continue to socially distance and we continue to obey the rules. And I need to ask you for a while longer to continue to do what I know is painful and difficult, to continue to stay home and obey the rules. Let me leave you with this thought. I know that for many of you, this is extremely difficult. You've lost your jobs. You're worried if the business you're going to go back to is still going to be there. You can't socialize. The poor folks who have lost a family member cannot go to see them when they're dying, and they cannot even have a funeral service for them. I reach out to them, and my heart wants to break. I'm worried too. But working together with the help of all of us and all of you, we're going to get through this. With the help of federal and state and local governments, we're going to get through this. And we're going to do everything we can as a local government to assist. If we can help you, just pick up the phone and call the mayor's office or call 311. That's what we're there for, and we're there to help you. Thanks very much for listening. I'll be back next week with another edition. And meanwhile, on my Facebook page, I have a daily update. Thanks very much. Stay safe.